Mental health care is very significant for everyone throughout the lifespan because if it is left untreated, it can lead to chronic health problems, substance abuse, serious mental health illness, and suicide. Therefore, healthcare professionals should be vigilant and competent to identify mental health disorders to provide timely care and prevent complications. In this presentation, we will focus on special population who are at high risk for mental health disorders. That includes elderly, perinatal or lactating women, pediatric or adolescent, LGBTQ, and immigrant workers. Let's first learn about elderly population. Our first special population is geriatric population. Major healthcare disorders, mental health disorders occurs in this age group includes dementia, depression, anxiety, Alzheimer's disease, neurological disease, and schizophrenia. The risk factor could be anything like chronic health conditions, disability, stress, social isolation, any trauma or sickness, asking for help. It can all lead to a mental health problems. Over 20% of adults aged 60 and over has mental or neurological disorders. Among them, 49.2 million adults over the age of 65 years and 1.4 to 4.8% suffer from serious mental health illness. Depression and anxiety are increasing in older adults that result in morbidity, mortality, hospitalization, and loss of functional status. Depression is the fifth leading cause of disability in United States. So differentiate between other cognitive disorders and depression is very important. Screening or assessment for mental health includes everything. Depression or sadness is not normal in this age group. They are at high risk for delirium, polypharmacy, and many medical conditions, all of which can present primarily or even exclusively with psychiatric problems. Evaluation for suicidal ideation is also very essential because there is elevated rate of completed suicide among this age group. Depression, anxiety, dementia, addiction, and other psychiatric problems are not a typical part of the aging, and when left untreated, they can cause many chronic illness and even suicide. Assessment for suicidal risk is important for every visit. Lab testing and imaging to rule out other medical disorders. Psychosocial assessment and DSM-5 criteria to rule out other disorders. PHQ-9 and GAD score for anxiety disorders and mini mental status exam to rule out cognitive impairment is important to differentiate other mental health disorders and truly neurocognitive disorders. Treatment for mental health disorder in this age group includes psychological support, emotional support, preventing elder abuse. It should be evaluated during every visit because abuse in elderly can cause depression, sadness, and other mental health illness. Reviewing polypharmacy if there is any medication that can cause these symptoms. And if needed, antidepressant medication such as SSRI or SNRI, considering its risk, adverse effect, and contraindication. Get support from friends and families so that they can help their loved ones by observing symptoms or providing treatments by watching the symptoms or of effectiveness of that treatment. Provide healthy lifestyle to help feeling of depression. Our second stage of special population is perinatal or lactating women. This is a vulnerable stage for the woman because they are facing many challenges, physical, psychological, and emotionally, that increase risk for postpartum depression and anxiety. 1 in 8 women with recent live births experience symptoms of postpartum depression. The approximation cost for untreated mental health disorders during this time is $14 billion with an average cost of $31,800 per mother-child pair with postpartum illness. The assessment or screening should include a perfect timing for screening for mental health disorders in postnatal women. The initial screening should be done at first postpartum visit, then 6-week postpartum obstetric visit, and repeated screening at 6 and 12 months, along with 3, 9, and 12-month pediatric visit. This screening should include both parents, because only mother is not suffering from postpartum depression, but father is also at high risk for getting a depression. The symptoms should be look for lasting feeling of sadness, sleep disturbance, crying, hopelessness, or doubting parenting skills. The evidence-based tool for assessment or diagnostic of this mood disorder or anxiety disorder includes Edinburgh Postnatal Depression Scale, PHQ-9, DSM-5, and GAD score. The treatment for postpartum depression or mood disorders includes a multidisciplinary team approach and include an obstetrician or internist and a psychiatrist. Patients with postpartum major depression who are breastfeeding their babies need to weigh various risks when deciding whether to use antidepressant medication, including the potential risk for untreated depression and of infant exposure to antidepressant medication. Other intervention should include providing enough sleep, healthy diet, and rest, providing psychological, emotional, and physical support to cope up with new situation, monitoring symptoms and adherence to treatment, and hospitalization if symptoms get worse. The third special population is pediatric or adolescent population. The common mental health disorders includes depression, anxiety, PTSD, suicide, and ADHD in this age group. 1 in 5 children from the age 13 and 18 will live with a mental illness, and only 30% of depressed teens are being treated. Mental illness can affect physical health, employment, education, and relationship, and need to be treated. In 2019, approximately 1 in 6 youth reported making a suicide plan in the past year, and a 44% increase since 2009. More than 1 in 3 high school students had experienced persistent feeling of sadness or hopelessness in 2019, with a 40% increase since 2009. Poor mental health in adolescents is more than feeling a blue. It can impact many areas of teenagers' life. Youth with poor mental health may struggle with school and grades, decision making, and their health. Mental health problems in youth often go hand by hand with other health and behavior risks, with increased risk of substance abuse, unhealthy sexual behavior, and unplanned pregnancy. Because many health behaviors and habits are established in this age group, will carry out throughout the adult years. So it is important to assess and screen for mental health disorders at right time and in a timely manner. The DSM-5 symptoms criteria includes 5 symptoms or more symptoms being present during the same 2-week period and represent a change from previous functioning. It presents nearly every day. And at least one of the symptoms is depressed mood or anhedonia. That means loss of interest. Screening for depression, screening for substance abuse, and screening for suicide or suicide ideation. The warning sign of mental health issue need to be educated with the patient and patient's family. Frequent comments about being worried or anxious, moodiness, decreased interaction with family, drop in grades, change in sleep, and change in eating pattern. If any of symptoms are observed in pediatric age group, it need to be talked with a primary care provider to get a treatment effectively and in a timely basis. The treatment for this age group includes psychotherapy, talk therapy, talk with loved one, because when you are in a stress, you are anxious, talk to a parent, teacher, or other trusted adult about problems, and they may be able to help you or help to learn managing stress. Get enough sleep, focus on the strength, take time to think about what you are good at or ways to do more of those things. Do things that make you happy. Find activities or hobbies that make you happy. Engage in physical activities, because exercise takes our mind off stress and release chemicals in our brain that makes us feel better. And if needed as a last resort, combine with a pharmacotherapy along with this healthy lifestyle, psychotherapy and cognitive behavior therapy, considering risk, benefit and adverse effect. The fourth special population is LGBTQ. This age group is facing many problems like ongoing homophobia, stigma, negative and usually unfair beliefs about themselves, discrimination at workplace or in a house discrimination can have negative effect on their health. Research shows that compared to other men, gay and bisexual men have higher chance of having major depression, bipolar disorder, generalized anxiety disorder, suicide and substance abuse. LGBTQ plus teens are 6 times more likely to experience depression, and LGBTQ in youth are more than twice as likely to feel suicidal. The factors that increase risk for mental health problem in this age group includes harassment and discrimination in education or workplace, discrimination at places of worship. LGBTQ population experience challenges in variety of situation and health disparities, family rejection. The high rate of lack of social acceptance can increase anxiety in this age group. An extreme lack of security increase feeling of worthlessness or hopelessness. The social challenge and related traumatic event in this age group elevate prevalence of PTSD. Assessment and screening in this age group includes mental health screening, PHQ-9 and GET screening, DSM-5 diagnostic criteria for depression and gender identity disorder dysphoria, suicidal ideation or plan, screening for unsafe sexual practices, and screening for substance abuse. Because evaluating on timely can help to treat various mental disorders such as PTSD, depression, panic disorders, social anxiety, or generalized anxiety disorder. Members of the LGBTQ community are hesitant to get help for mental health issue or a substance use disorder because of the lack of available resources and the stigma surrounding how they choose to identify. Therefore, establishing trust should be the priority. Provide trauma-informed care, psychotherapy, cognitive behavior therapy. As a provider, we can help them by listening them, support their search for help, and become an LGBTQ ally. As a last resort, if needed, combine with this therapy of pharmacotherapy. The last special population group is immigrant or migrant workers. The common mental health disorders in this age group include major depressive disorder, post-traumatic stress disorder, anxiety, adjustment disorder, and substance abuse. Immigrants experience more problems with this mental health problem because of migration process and stress suffered at the various stage. Immigration-related stressors can increase suicidal ideation and risk due to distress associated with cultural stress, social marginalization, and conflict in addition to PTSD and other psychological disorders. There are more than 1 billion people globally are immigrant, refugee, and migrants, which is 1 in 7 of the global population. Among children in immigrant families, healthcare providers reported that 50% increase in anxiety and depression diagnosis, 25% increase in seeking mental health. Assessment and diagnostic criteria should include mental health screening, history and physical examination, behavior or observation that may indicate significant mental health issue, including visible distress or crying, acting withdrawn or slow to communicate, uncontrolled laughter or making light of tragic situation, tangential or disorganized thought, signs of psychosis such as auditory or visual hallucination, screening for suicidal ideation, DSM-5 screening, PTSD-TSN screening, and PHQ-9 screening along with substance abuse. The treatment of these disorders includes psychotherapy, addressing language barrier to get a healthcare facility or to get a health treatment, cognitive behavior therapy, providing emotional support, and finally pharmacotherapy. The treatment varies according to the mental health disorder diagnosis. If it's just an adjustment disorder, then usually therapy is going to work, and to a lesser extent, we need a medication or pharmacotherapy. For anxiety disorder, it should be sometimes needed a combination of therapy along with the medication. And for depression, the treatment is a longer depression treatment is for the longer period of time, and it includes a combination of therapy along with the medication. It is a very crucial role for us as a medical professional or healthcare provider to help our population, including special population and everyone throughout the lifespan, by timely and quickly evaluating a mental health disorder and refer them when they need a treatment with a effective and efficient care. Thank you.